professor of surgery at Washington University. Let me hit the button here. Good morning, Dr. Bradley Freeman.
Hey, good morning, McGraw.
Let's talk about hospital records and your medical records. You're telling me that if I were to look at my medical records, chances are there'll be a mistake?
Well, two things. It's probably not a secret to the medical profession that there's errors in the medical record in terms of the history we obtain from patients and maybe the medication lists and that sort of thing. But the thing that brought this to the fore are efforts by a lot of hospital organizations as well as private physicians groups who really want to provide patients with access to their medical record. And the thing that enables this, obviously, is the switch or migration to electronic medical record, meaning the day when your physician would scribble notes on a paper chart is rapidly coming to a close, and everything is now electronic. And technology exists so that patients can now access that themselves. And there's a lot of advantages to that, but this is data from a study reported from the University of Chicago that looked at what effect that had on patients. And one of the effects was that patients could look at their medical record and correct errors in it. And some of these errors might be relatively trivial, meaning that they would not have any impact on their care, but others might be very substantial, and they would correct things such as bring into the physician's attention that they're actually taking other medications that aren't reflected in the medical record, or that they're no longer taking medications that are reflected in the medical record, or, for instance, that they are continuing to have a problem with one of their medical conditions. And one of the things this study brought up is that the patients that participated in this exercise were much more prepared and engaged when they came to their physician visit. So it really encourages buy-in, and we know that really translates into more satisfied patients or satisfied customers, and actually better outcomes in medical care. So I think this is a very positive development, and I think increasingly patients are going to have the opportunity to do this.
It brings up a tangential question that I'm going to ask you, Doctor, and that is mistakes found on your record are one thing, but how often do you find patients lying to you about their issues or symptoms or things like that?
Well, that's a very good question, and it's very hard we're all human, patients and physicians, and there's some things that are difficult to talk about. So, for instance, a patient might not want to volunteer or disclose that they have a problem with drug abuse, or they might not want to volunteer how much alcohol they consume, or they might minimize, say, the amount of problems they have with tobacco or something like that.
Right.
So, I think, obviously, those kind of encounters are very, you cover some very sensitive topics, and that's why it's important to have, trust. It's a two-way street, and it's important to have trust both ways, and it's important for patients to have trust in their physician and physicians to have that rapport with patients. But yeah, I think it's an issue for some things.
Yeah, you know what? Even myself, not to get too personal here, but there's times where one time I went to go see a dermatologist, and I had a mole in a not your normal place, and I was like, okay, the doc, this is going to be a little weird. He's like, I've seen it all. Don't worry about it. So, I'm not used to doing something like that, but we should understand that doctors do it all day long, and it's no big deal for a doctor, right?
Right. By and large, though, when you say I've seen it all, then the patient will come in and show you something you've never seen. I say that, but yes, and I think it goes back to the nature of the physician-patient relationship, and having trust and confidentiality and all that sort of thing, and we all strive to be as confidential and professional and compassionate in those kind of interactions.
Yeah. All right, let's move on. What is a bionic pancreas?
So this is pretty exciting. It's come out, been reported in the last week, and this pertains to people with what is called type 1 diabetes, and to make a complicated subject short, type 1 diabetes is the result of a pancreas not producing enough insulin. So people that have this type of diabetes traditionally have had to give themselves insulin injections and monitor their glucose level in their blood by finger sticks several times a day and watching what they eat. In the last several years, there's been something come out that has come on the market and available called the insulin pump, which actually delivers this as more of either a continuous or kind of an automated fashion. But this group in Boston has come out with what they call a bionic pancreas, and what it entails is it infuses insulin. It infuses another hormone that the pancreas is responsible for secreting, and that's called glucagon. It interfaces with basically an app on an iPhone.
Of course it does.
And naturally, and then it has a sensor to monitor the blood sugar. And these are relatively brief trials, but they compared it with the insulin infusion pump, and they found a couple of things. Number one was that the blood sugar control, which everybody strives for, was better, and the problem with getting excess insulin, which would be manifested by your blood sugar becoming too low, was less. So I think this is very exciting, and the other interesting thing about it was the only input that the patient had to provide was their weight and when they ate. So really a very simple interface. And so obviously I think this is a prototype, but I think that this potentially is a game changer in the management of diabetics, and so I think this technology is going to evolve very rapidly, and something that will probably make it to the bedside pretty quickly.
I'll tell you this. Go ahead, Kelly.
I was going to say, would they be able to do something like this for type 2 as well?
Well, I think the cause of type 2 is a little bit different, Kelly. So type 2, typically those people make insulin, and their body basically is resistant to it. So this particular device would not help people with type 2 diabetes, and so it's more for the people that have the problem that their pancreas doesn't manufacture enough insulin.
I'll tell you, I was at a lunch with a friend of mine not too long ago, and he had he was type 1 diabetes, and had a reaction, or the pump didn't work in time, or it didn't eat in time, and he went into some type of shock. And that's pretty scary when you don't exactly know what's going on, and somebody you're sitting with goes into some type of shock. I had to call the ambulance. It was a pretty interesting afternoon.
Absolutely, and it's literally life-threatening. So and potentially this technology would prevent those types of episodes.
Yeah, and I should also say, doctor, that my friend was, while they were in this reaction, they were yelling at me. How dare you call? And I'm like, I'm sorry. I'm trying to help you. And only after they came back, after they gave him some juice, did they come back. And then they said, "Oh my goodness, thank you." So in those instances, you have to sort of be aware that they're not acting in their full capacity at that time.
Oh no, absolutely not. They're not rational, and the family members and care providers have to know how to react to that. Absolutely. So it's not a trivial occurrence.
Yeah. Yeah, it was interesting. All right, doctor. Be good. Thanks for checking in. Have a good week, and we'll talk to you next Wednesday.
Hey, have a great week.
Dr. Bradley Freeman, who says he's seen it all, and then they show him something he's never seen before.
And maybe not.
I should clarify. I went to go see a dermatologist, and you know how they want you to check your moles for skin cancer and everything? So I was like, okay. He's like, I've seen it all. Don't worry about it. So I showed it to him. He's like, don't worry about it.
Oh, so I guess he had
seen it before, so it's no big deal. But it's a little awkward to be like, "Hey, doc, how you doing?
I know.
Nice to meet you." And then you're like, "How do you do?"
Exactly.
Yeah,
that's what they're there for.